Hey there, YouTube fans. How you going, man? Hey, Teacher Cell here with you. Hey, I wanted to talk about this whole chronic fatigue syndrome business. I've been doing a lot of research. I've had a flare-up lately where I felt really rotten in the morning, and I'm having problems trying to sleep, and I'm just sore, and my brain's fogged, and just everything. And it seems to stem from I had some time in the hospital recently with infection, infective colitis, and from that, with all the antibiotics and everything, I've felt really bad. But in that time now, I've had a chance to do some more research, and I have another couple of theories that I wanted to put together whilst I still have this research fresh in my mind. Before I forget, I am trialing a little bit of caffeine. So these this is no dose plus, and I knew that if I took 100 milligrams, which is one whole capsule, I will have a massive headache and it'll be nasty for me. So I've tried 50 milligrams today. It still gave me a headache, but it did kind of wake me up a bit. So I'm having issues with this mic. Oh man. Okay. Yeah, but I did have the headache and I did have higher blood pressure, so I have to have a think about what I'm going to do with that. I did email myself some research. You can have long-term side effects from chemotherapy. So I was given cisplatin and doxorubicin, two chemotherapy drugs about 10 years ago, 10 years ago. And from the surgery or from those drugs, it is possible to still have chronic fatigue years later. The other thing is, there's an article here, it's titled Hypersensitivity to Orthopedic Implants. And so I'm going to talk about the titanium shoulder and this whole reverse shoulder implant in me. And I've got more titanium from my stomach being stapled after gastric sleeve. So I've got a lot of titanium, cobalt, chromium, things like that in my system. Also, you could react to the glues that are in the system, and apparently your body can, or titanium can leach ions into your bloodstream or whatever into your body, and then your immune system thinks it's a foreign invader and it starts attacking it, and so you have an immunological response. I'm going to go through this article by Joseph Warwarzinski and Joseph A. Gill and Goodman and Gregory Waryast. And I'll just go through the main points. So, testing patients with functional implants, so like titanium and that, is not a clinically useful approach, as the hypersensitivity is higher in implant recipients than the general population. So people can have failure of their implants. They can get allergic to the implants and that, and so they fail and they have to be removed. But patients often report hypersensitivity reactions to the metals found in costume jewelry, belt buckles, or watches. So, for example, if I wear a watch, I'm allergic to the nickel or the stainless steel in the watch. I definitely react to metals. There can be as much as 1% nickel in some of these titanium alloy implants. It's just an impurity in the titanium, so you could react to that. It says here, patients often report, I said that. The most common metal sensitizer in humans is nickel, as we said, although beryllium, cobalt, that's definitely in my implant, chromium, tantalum, titanium's definitely in my implant, and vanadium have also been shown to induce hypersensitivity responses in tissues. Contact allergy to nickel, cobalt, and chromium is seen in 15.5%, 6.2%, and 2.3% respectively. Now, you can get a patch test, and I may speak about this later on, where you can, an immunologist, or whatever they call a doctor, immunity specialist doctor, can, they basically put small amounts of metal in your back, and if you react to it, you may be reacting to the titanium implant in your body. But it's not cut and dry. Like this, the skin response could be different to your systemic response. So that's something that I found in here. So I spoke about that we can, the cement that you could react to, like bone cement, when they put that in there, when they put that implant, is such as gentamicin sulfate, benzyl peroxide, hydroquinone, 2-hydroxyethyl methacrylate, copper sulfate, methyl methacrylate, N-dimethyl p-toluidine. These are the glues that you can react to. So you could react to the glue, not necessarily the titanium or the cobalt or whatever. It says here, nevertheless, these metals can sensitize a body and provoke an immune reaction. And then if you got that immune reaction, that can lead to that chronic fatigue, that brain fog, etc., etc. Now, circulating metal ions, that's what I said, increase following joint replacement, especially in patients who have experienced implant loosening. This increase has been attributed to the accumulation and continual release of metal ions into the tissue surrounding the implant as a result of the inevitable corrosive process. So they still corrode even though they're titanium, titanium alloy. These metal ions may trigger a localized inflammatory response that can lead to implant failure. Low-grade systemic inflammation is what can occur. There seems to be IL-17 or IL-12, I think it's 17 response, T mast cells response in chronic fatigue. This article is based on previously conducted studies, so this was basically like a meta study. Immune response mounted against metallic particles. Okay, the hypersensitivity reaction is typically in an immune response mounted against metallic particles that are released as a result of implant wear or corrosion. You can have capable of acting as antigens for circulating lymphocytes. In doing so, haptens induce an immediate humoral hypersensitivity response characterized by the formation of autobodies and immune complexes. So these Th1 lymphocytes release pro-inflammatory cytokines, that's TNF-alpha, IFNY, interleukin-1, interleukin-2, which recruit macrophages to the site of the implant. So this whole immunological response. There's been a lot of problems with metal-on-metal implants over the years, and a lot of problems because you get cobalt poisoning. Now, some people had the removal of the implant or administration of immunosuppressive medication was some treatments. Significant levels of metal ions have been found in the periprosthetic tissues as well as the liver, spleen, lymph nodes, and urine serum of hip arthroscopy patients, demonstrating that this is more than a purely localized phenomenon. So it gets into your system: liver, spleen, lymph nodes, and urine. Again, human leukocytes. So there's that immunological response. Alternatively, hypersensitivity to metallic implants may be a reaction to separate components of the implant, including allergens in the bone cement, which is what we talked about, such as the acrylates, benzoyl peroxide, and these other uh, um, things, gentamicin, and a couple others I can't pronounce. So, clinical manifestations, implant-related hypersensitivity is difficult to diagnose. And this is a really big one here that I've highlighted. There is also evidence that metal sensitivity may play a role in causing the conditions of chronic fatigue syndrome. I'll say this again. According to this article, there is evidence that metal sensitivity, so allergic to metals, may play a role in causing the conditions of chronic fatigue syndrome. There are a couple of tests you can try and find. I found it very hard to find these tests in Australia. There is the lymphocyte transformation testing, or LTT. I've heard of a MELISA test, MELISA. The patch test, which is not always, like we talked about, they put metals into your back and they wait up to 2 days to see if there's a response. So next page. Sorry if this is a little boring, but this information is gold, basically. Although hypersensitivity may play a role in implant failure, a distinction exists between the cutaneous immune reaction to metals, so the skin reaction to metals, as manifested by patch testing, which is what I said earlier, and the periprosthetic hypersensitivity to metallic implants. In other words, if it's in your body, you may have a different reaction. Patch test reactivity has been suggested as a potential method to screen for patients at risk of developing hypersensitivity reaction to a metallic implant. It's quite expensive, though, to have this patch test. In patients presenting with a suspected allergic reaction to a metallic implant in the absence of implant failure, Thiessen and et al. Suggest that the workup should include patch testing and consideration of in vitro peripheral lymphocyte proliferation testing, which is that LTT test, lymphocyte transformation test. Okay, next page. Counseling a surgeon to use a less immunogenic titanium device was sufficient. So you can get now, I don't know how old these are, you can get titanium alloy implants that are coated in a kind of polyurethane, I believe it is, or you can get zircadian implants. So what I'm trying to say is there are possible alternatives to less reactive implants, less, like less allergic, like a hypoallergenic type of implant, which is those ones that the metals are covered, they're encased, and I'm pretty sure it's in a polyurethane, or the zircadia, like you have in your teeth implants. You can have zircadia, dental implants instead of the titanium ones. In 6 of 10 patients who recognized a metal allergy after implantation, the metallic device was removed and symptoms resolved. Well, that's a big ask for me. Like, are they going to pull out my shoulder implant and pull it out of my humerus and what I've got left there above my elbow? What a nightmare. I mean, I just can't do it, man, unless there was a problem with it. Apparently it's a big deal to try and get that out. It's screwed into your shoulder as well. There's another video I've done doing a reverse shoulder implant, it's a big deal. It's probably not an option for me at all. Preoperative patch testing was not necessary, and that cobalt, chromium, and stainless steel implants should be used in patients with a suspected metal allergy, regardless of the results of patch testing. That's why they do them. There's debate about it. There's debate about doing a patch test before you get an implant. This is what I said here. You can choose a less immunogenic device for implantation. Okay. Patch test positive patients were those who tested positive to cobalt, chromium, stainless steel, and titanium, aluminium, vanadium, the most commonly used alloys in orthopedic prostheses. My shoulder definitely has chromium, cobalt, and titanium, definitely. Some people had titanium screws removed and improved. That covering, the coating that I'm talking about is called polytetrafluoroethylene. So you can use an implanted device that has been coated with polytetrafluoroethylene. Try and say that in a big sentence. Nickel and cobalt. Nickel is a real problem in these implants. Some people who've had the dermatitis cleared rapidly upon removal of the implant in the 5 fibromyalgia and CFS, chronic fatigue syndrome patients presented by Stezskal, and all symptoms resolved following the removal of the metal implant. So there's been people that have said, enough's enough, I'll remove it, and they've gotten better of their metallic implants. Although the majority of prostheses use cobalt chromium alloys with a nickel content of less than 1%, with a very low theoretical risk of infection, a case of a TKA patient who developed painful systemic allergic contact dermatitis has been reported. This is very rare reaction, was attributed to the chromium in the implant. So we talked about zirconium niobium alloy prostheses. Zirconium. One patient had his dermatitis resolved without recurrence within a year. In metal-on-metal joint prostheses, corrosion and the release of metal particles and ions into the joint, which instigates an immune reaction. So metal on metal is a real problem. Metal ion levels in the blood, which is what we talked about. Conclusions, patch testing or LTT is an option to see if you react to those metals. Replacement of the implant with a non-allergic prosthesis resulted in elimination of symptoms in some people. What a drama. This is the thing. What do you do? What do you do if you've got chromium, titanium, all this glue in you, and you're having chronic fatigue syndrome? It's not as if you can easily just pull it out sometimes, unless it's seriously affecting your life. Well, that's a debate, isn't it? So those are the things. That's my point here, guys. Sorry if it's a little bit boring, but sometimes these articles are like that. My theories, and they're educated ones, they're on research. Why do I have this chronic fatigue ever since I had cancer, ever since I had implants in me and chemotherapy? It could be from the chemotherapy itself. God knows it changes your DNA, apparently. You can have more chance of having cancer and all these dramas. But, you're still alive, right? Because in the case of bone cancer that's in your arm, it can metastasize into your lungs, and then you're finito. It can metastasize all over your body. So it can be the chemotherapy, cisplatin, doxorubicin I had. Some of these can cause long-term fatigue, basically cancer-related fatigue, or it can be the titanium in your body, or it can be from the cancer, the surgery. The surgery is another one. Surgery can give you chronic fatigue syndrome. So there's really no real way of knowing in me what it could be. I just know that I've got it. And there's certain things that help and certain things that make things worse. Like last night, I couldn't sleep. I have been having problems sleeping the last few nights, which is interesting because it's just when I'm having this, flare up. And, what was my point about that? So I feel worse. Yeah. So not sleeping, I feel worse. Really bad. Felt really bad this morning. Hope that helps somebody, getting that information out there. I could not research enough this topic. Chronic fatigue syndrome is very complicated, very complex. And I did do a playlist on my channel. So if you look at my playlist, when I've come across a really interesting video that's on chronic fatigue, I've linked it in my playlist. So have a look at that. Thanks for watching, guys. I'll see you in the next one, whenever that will be. I support Ukraine. Slava Ukraini. Please donate to the Save the Children Fund for Ukraine. Take care, guys. Teach yourself out. God bless.